I'm Tracy Truelove with the Pitkin County Incident Management Team.
Good afternoon. I'm Valerie MacDonald, Pitkin County Emergency Manager. I work for the Sheriff's Office.
One of the big challenges we have on an incident like this, first I'll say that we haven't seen anything like it nationwide, right? This team works together, trains together, but it's often been on planned exercises or incidents, X Games being one of those examples. So one of the things we noticed early on is that public health had a really big job of creating a public health order. So that public health order would come into the incident management team. There would be different sections of our team, including logistics, operations, the finance section, that we all have to look at what that public health order does and how it impacts our community. Again, that there's so much complexity what public health is having to do and put together. Our team then is kind of trying to break it down and make sure we understand the guidance that we're then sending out to our community as information. So there's just a ton of things always moving. You come in a day and think you're going to work on one thing, and then something new will have come down from the state or from the CDC or from WHO or from the national platform. And so we're just always constantly reacting to what we're being given to then provide the best information we can to the community. And what's interesting about this kind of incident command structure we're currently in, you see this a lot on wildfires, for those of you that were around when Lake Christine happened a couple summers ago. You tend to have a sense of those kinds of incidences around containment. What does that look like? Well, we know, all of us know from living through this here in the community, we don't have a sense of what containment looks like yet. There's definitely hope. We keep holding out hope. We keep holding out that our community will help us work together to make this as least impactful as it can be to us. But we recognize this is a new incident that we're dealing with. So we're kind of actually even changing some of the way we operate in the incident command structure.
And just to build off of what Tracy was saying, this is so unprecedented in our lifetime. We train so much for wildfire, and in a wildfire, you see the fire, you see the response, you know it's going to end. We're just in uncharted territory here. We have all hands on deck. I talked about these 15 emergency support function teams, and a perfect example of one of those teams is Human Services. That team is fully activated, dealing with the consequences of so many people being unemployed and dealing with their mental and spiritual well-being. These teams consist of subject matter experts. There's over 200 people on these teams that have been training their whole careers for this incident.
But I'd like to kind of share who some of those agencies are, because you may not know the breadth of what we have in the incident management team and the EOC. So we have Pitkin County and Pitkin County Public Health. We have the city of Aspen. They're actually letting me be here on loan to be part of the incident. The town of Snowmass and Basalt, the emergency services and law enforcement from Aspen Police Department, Basalt, Snowmass Police Departments, Pitkin County Sheriff, and the dispatch team here in Pitkin County. Also Carbondale Fire, Roaring Fork Fire Rescue, Aspen Fire, and Aspen Ambulance District, not to mention Mountain Rescue. And then that isn't to say, again, all the stakeholder partners who've been such an important piece of this response with us. That would be Aspen Valley Hospital, Aspen Ski Company. The list goes on. And again, we have meetings weekly with those teams to kind of find out what they're hearing from the community and what our team needs to do to strategically get more information out as needed.
Never in most people's wildest imagination did we think we'd be dealing with a worldwide pandemic. The cavalry is not coming to save us. Some of our state partners have definitely stepped up, CDPHE and Department of Homeland Security, Office of Emergency Management, but everyone is in the same situation as we are. Scarcity of resources is real. The fact that we've got this system in place, I have confidence that we'll get through this the very best we can with what we've got to work with our dedicated teams.
And we recognize that sometimes it's frustrating that you're not getting the answers to the questions that you have. But I can assure you, there isn't a playbook for how this is working. Again, we're kind of having to roll with it a lot of times as the information is coming into us as well. But just know that we are your neighbors. A lot of us are your friends. We're really feeling like this is something we have to ask your help in as well. We're trying to put out information that can help you make some good decisions. And again, I think if everybody recognizes that, again, we're in this together, as Val said, we're going to come out stronger through it in the end.